High blood pressure constitutes 47% of the risk of developing blockage in the arteries of the heart later in life. I think one of the things that we miss starting K through 12 education is that we don't really learn a lot about health. We inhabit our bodies from the time our eyes open to the time our eyes close for the final time, and we just don't know. And that's a shame. It takes some effort, but if you're going to a doctor and you want to have a good lifespan and a good quality of life, which are two very separate things. We live on average 78 years in the United States, but on average, the last 10 to 15 years of your life are dealing with chronic illness. No one wants to live that way. So we got to improve both. High blood pressure constitutes 47% of the risk of developing blockage in the arteries of the heart later in life. An example I can give is a close friend of mine, way back from high school, texted me a few months ago and was like, my blood pressure was 150s over 90s at his primary care provider's office. And that usually warrants two blood pressure medications. He got a blood pressure cuff from a pharmacy, like I told him to check it daily, at least once a day, which I would recommend that everyone do just to screen, because you go once a year to the doctor. That's one data point, and there are 364 days left. So it doesn't really tell you whether you have high blood pressure or not. But what I told him when he got those same results on his home blood pressure readings was go to your pantry and look at the sodium and the percent daily value. And an example I give is if people eat sushi, soy sauce, 1 tablespoon, and I'm using more than 1 tablespoon when I eat sushi, 25% of your day's sodium. To use another example that's perhaps more approachable, if you take two hamburger buns with nothing in between, it's between 11 and 14% of your day's sodium. Hot sauce, 1 teaspoon, 4 to 11%, depending on the brand, and on and on and on. And so I told them, go through your pantry, basically eliminate the high levels, or at least be aware of what the serving size is so you can limit yourself. He ended up doing that, checked his blood pressure, and about a month, 2 months later, he tells me that he's been checking every day and it is stone cold normal. So you can save yourself from developing disease and also the cost of medications by lifestyle interventions, by watching what you eat sodium wise.